This is an abridged version of the Gynecare TVT Exact surgical procedure. Please refer to the IFU and surgical technique for complete instructions. The Gynecare TVT Exact continence system is comprised of the trocar, trocar handle, trocar shaft, the trocar sheaths, and attached Prolene polypropylene mesh implant, and the Gynecare TVT reusable rigid catheter guide. The rigid catheter guide is not included. These components work together to form the Gynecare TVT Exact continence system. Let's begin. Insert an 18 French foley catheter and leave it open to drainage. Locate and mark the two suprapubic exit sites. These should be 2 centimeters on each side of the midline, immediately above the pubic symphysis. They should be in contact with the dorsal aspect of the pubic bone, in order to avoid the inferior epigastric vessels. At the level of the mid-urethra, inject local anesthesia submucosally. This creates a space between the vaginal wall and the periurethral fascia. Now perform a retropubic hydrodissection. This will open up the retropubic space and minimize the risk of bladder puncture during the passage of the trocars. Start at the needle exit sites and pass an 18-gauge spinal needle along the back of the pubic symphysis until the needle touches the endopelvic fascia. Back the needle off the fascia roughly 1 to 2 centimeters. Inject 30 to 50 cc's local anesthesia on each side. Ensure the needle tip passes behind the pubis and into the rectus sheath. Next, make a sagittal incision about 1.5 centimeters long, starting 1 centimeter cephalad from the urethra meatus. This incision will be positioned over the mid-urethra and allow for subsequent passage of the implant. Make 2 small 0.5 to 1 centimeter paraurethral lateral dissections between the vaginal wall and the periurethral fascia. These dissections will accommodate the insertion of the trocar sheath tips. Drain the bladder through the catheter. Confirm that the bladder is empty. Next, insert the Gynecare TVT rigid catheter guide into the channel of the 18 French foley catheter. Push the tip of the foley catheter toward the posterior lateral wall of the bladder, opposite the intended passage of the trocar sheath. Now prepare the Gynecare TVT Exact device. Secure the trocar sheath over the trocar shaft by hooking the trocar sheath cutout onto the trocar sheath lock, which is located on the trocar handle. Begin the insertion by holding the trocar handle in your dominant hand. Control the initial insertion using the non-dominant hand by placing the index finger in the vagina under the anterior vaginal wall, just lateral to the suburethral incision. Orient the trocar sheath tip horizontally in the frontal plane during the initial submucosal passage in the paraurethral dissected space. Pass the tip of the trocar sheath until it has reached the end of the dissected space. During perforation of the urogenital diaphragm, lower the trocar handle to ensure that the trocar sheath tip passes vertically while staying in close contact with the back of the pubic symphysis. Pass the tip of the trocar sheath until it has reached the end of the dissected space. Now move the non-dominant hand from the vagina to the suprapubic exit site. Continue to keep the handle low while aiming the trocar sheath tip towards the pre-marked abdominal exit sites and advance the trocar sheath tip through the retropubic space. Push the trocar sheath tip through the rectus muscle and the skin. If desired, make a skin incision at the point where it tents the skin. Grasp the exposed trocar sheath tip and pull gently upwards. Remove the trocar sheath by pushing it laterally off the trocar sheath lock. Carefully withdraw the trocar shaft from within the trocar sheath. Repeat the technique on the patient's other side. Prepare the GynaCare TVT Exact system. Push the tip of the foley catheter to displace the bladder to the contralateral side. Push the trocar sheath tip through the skin. Pull the trocar sheath laterally and off the trocar sheath lock. Carefully withdraw the trocar shaft from within the trocar sheath. Remove the 18 French Foley catheter and perform a cystoscopy to confirm bladder integrity. Gently pull the trocar sheaths upward to bring the implant loosely under the mid-urethra. Adjust the implant to desired tension. Cut the implant bilaterally, close to the trocar sheaths, and clamp the implant sheath while being careful to avoid clamping the implant. Place a blunt instrument, such as scissors or forceps, between the urethra and the implant to stabilize the implant during implant sheath removal. Carefully remove the plastic sheaths surrounding the proline mesh. If needed, make any final implant adjustments. Cut the ends of the implant just below skin level and close the vaginal and abdominal skin incisions. This concludes the GynaCare TVT Exact retropubic procedure.